considering time is also of essence. And, I will just quickly get into the thick of things. Now, again, the conversation is in regards to the, well, it's fresh on the table. That is the task force report on mental health, a committee that was set up, as I said, by His Excellency the President Uhuru Kenyatta last year, towards the end of last year, and they went around the country collecting views and talking to Kenyans to find out what do we need to do about our mental health space as a nation and as a people. So to have this conversation is Charity Muturi. In the mental health space, Charity is not a stranger. Charity has been in these corridors of mental health conversations for very, very long, and she's got a distinguished commitment with her life in this conversation. And she was part and still is a part and a member of the National Task Force on Mental Health. She is also the chairperson of Tunawiri, CBO, and also sits at a global level. Musicheze na Charity, anakaa huko global. And she sits as the Global Advisory Non-Communicable Diseases Alliance. So we can pretty much say, Charity, you are a well and all-rounded individual in about our mental health and to some level physical health. But maybe I might have missed one or two things about you. So what have I missed? Maybe just to give all our viewers and our participants an idea of, or a more idea about Charity.
Okay, thank you so much, Eddie. It is such a pleasure to be here. I have been admiring for a long time what Basic Needs, Basic Rights has been doing. We've met in a few forums, but this is the first time we're doing something together. So thank you for facilitating that. Yes, your introduction is pretty much it. Yes, I'm Charity. I live with bipolar disorder. I care for a family member with a similar condition. I am the chairperson of Tunawiri CBO, and we focus on patient advocacy and also mental health in the criminal justice system, which includes prisons, and currently with a program at Mathari Hospital Maximum Security Unit and Yatta Prison. And I've also been a board member of a school, government school for children with intellectual disabilities for the last 10 years. And so I've had, more experience with intellectual disabilities even before I was diagnosed 5 years ago. And yeah, so I'm excited to be here.
Welcome, Charity. I know your credentials are very powerful in the sense that you've really committed a lot, not only having your lived experience in your life, and you have committed and dedicated a lot of your energy into this conversation at a very high level. And we are honored to have you here. And we are looking forward to have this conversation so that we can break down or just understand more. Now, our conversations, Charity, are not that, we're not stiff and serious. We just want to have a light-hearted conversation, but at the same time, opening up minds to this conversation, making it clear about the importance of our mental health and our wellness, and also to let people understand that these are conversations that should be very, very normal. They should be part and parcel of how we deal with our day-to-day, engagements. We should not feel strange talking about our minds and what is happening. So maybe we will go from the onset. For the longest time, the government has been put on the spotlight that it has not given a lot of attention to the mental health and wellness of its people. There have been attempts, there have been engagements there, but we've never seen proper outcomes or policies being actioned. There is a policy that was done, I think, some years back, but it was shelved. Nothing much happened to it until the president came out very, very strongly last year and said he needs to have some attention given to this. What was the culmination to that? And I know you sit somewhere where you've seen that journey. What was the culmination to that when the president said, we need to put together a task force, and there you are part of it?
Okay. So I think I've put something on my screen to follow, so I hope you can still see me. Yes, on June 1st, okay, on June 1st, President Uhuru Kenyatta did mention during his Madaraka Day speech last year that yes, you know, mental health is now a crisis that needs to be addressed, and ordered the Ministry of Health to actually implement programs and policies to address the problem. So what followed was a cabinet meeting on the 21st of November, where in cabinet they directed the formation of a mental health task force to address the mental health concerns of the country and help to guide the government on where resource allocation needs to be done. And so on December 11th, the task force was created and given 80 days to address priority issues, practical solutions, and our preparedness across different areas: framework, social determinants, and so on. I mean, they are big words, but we will simplify them through this conversation. And so the task force went to 10 regions and also reviewed literature, looked at the global context, and also provided solutions to the issues that Kenyans raise. And I am so proud of our country and our people and our users of mental health services and caregivers for showing up, for sending emails and contributing towards the public participation process. But after that, we had sector-specific meetings. So we had a meeting with the youth who contributed. We had a meeting with the security sector, education sector, professional societies. We met religious leaders, government department, politicians, and also persons with lived experience of mental health conditions and caregivers. So the discussions were held with over 2,000 Kenyans, and you know, there was also a BBI recommendation that there should be a creation of a body to monitor and report the state of mental health and well-being in Kenya. This process started in December. And honestly, by then, I didn't even, you know, understand what a task force was and so on. And we had conversations with civil society, many organizations, and we felt that we are not quite represented in the task force. We had a few issues we wanted to raise. And what I did was from that meeting, create a poster of all the issues we raised and sent it to Kenyans and encourage them to engage the task force in the concerns. And so what really stood out for me is that users of mental health services and caregivers started inboxing me, and when we got to 10, I formed a WhatsApp group in the true Kenyan fashion, and you know, we started discussing and saying the biggest thing for us was that we are not included in the task force. And so we on social media, on main media, and got an opportunity to actually challenge the task force, and they gave us an opportunity, and they said, okay, we can provide a seat for a user of lived experience and caregiver. So and among the 10 of us, Eddie included, we you know, looked at it and said, okay, this is one seat. We are people across different conditions. Why don't we come together and bring our issues together to raise to the task force together? So we are a team of people across very many different.
So definitely this was quite a big and important inclusion in the task force, which definitely with all right intentions, they humbly welcomed this inclusion into the task force. So before we get into that, because I know you're very passionate about the conversations about caregivers and of course the users, the task force was made up of which, because I know there are the subsectors in each of the task force, so that we can just understand how broad this went in terms of what they delved into when they were doing the public participation, just to have a scope of the various subsectors.
Please repeat the question, sorry.
There has, of course, I'll say it was really important that the task force included this very important part, that is for the caregivers and the users. So the question I have, maybe before we go into that deep, I would like also to go to that later on. What were the subsectors within the committees, so that we can just understand the broadness of what they tackled as they did the public participation?
Okay, thank you. Yes, it was in fact, the first poster was talking about looking at the state of mental health in Kenya, the legal frameworks around mental health, social determinants, among other areas. But later it was simplified so that it's easier for people to participate. So it was simplified to priority issues. Yes, priority issues, practical solutions, and preparedness. And within the task force, now, you know, we have several people who, there's actually a summary of the team. So we have a specialist from the World Bank. We have someone who's in the department of WHO here in Kenya, in the area of non-communicable diseases, mental health, disability, and so on. We have a forensic psychologist who's the only forensic psychologist in the country, and he sits he's the chair actually of the Kenya Professional and Counselors Association. Githua, yes. Actually, the WHO representative. Yes, Dr. Oscar Githua, yes. The WHO representative is Dr. Nato. We have Dr. Bernard Olayo, who sits at the World Bank in the area of health financing. We have Dr. Njenga, who is the chair, and the chair of Chiromo Health Services as well. We have Melanie Blake, who is a psychiatric nurse from the UK, who has started the only community health program we have in Kenya. And because we are moving towards community health, she has provided a lot of, insight into starting a community health program, because, you know, they've trained over, I think of almost 100 nurses in psychiatric nursing across the country, and a few other people. But then we also have the Secretariat, who are members of the Ministry of Health. So they were involved in a lot of logistics and data, but they also provided a lot of experience. And so, you know, it's quite a board. It's people with a lot of experience in this country. And, you know, we are very privileged to have been part of this process.
You know, the reason why I did that, Charity, is because for years as Kenyans, we are so used to seeing committees being formed left, right, and center. And sometimes we don't know what the makeup is. And I did that because being passionate about this conversation, it's always good just to understand when something like that is done, we have the right people there. And it's really clear from what you've just discussed, got the right minds around that. And of course, being led by Dr. Frank Njenga. And it's good to have, when we are releasing it, saying mental health also should actually be considered what do we call it? Should be declared mental health national disaster. And by the time you see somebody of the caliber of Dr. Njenga saying that, it means we are in dire need of the application of the recommendations that have been put across. So of course and those are the things I'd like to sort of break. You can see there is report that going to be, if you just do conditions. And just before you go on, I'd like to welcome those who just joined us in the conversations with Eddie. And we are privileged to have Charity Muturi, who is our guest this afternoon. Charity Muturi is a member of the National Task Force on Mental Health, and she's also the chairperson of Tunawiri CBO, and also sits and she's part of the Global Advisory Non-Communicable Diseases Alliance. So that's who we are talking to, and we've already kicked off by finding out about the report, how the task force was formed, who is in that report. And now we'd like to have a look at, or in-depth, about the recommendations that have been put in there, about 15 of them, if I'm not wrong. And some of you are familiar about the report, some of you do not know, but this is where you need to be for you to know a little bit more about that. So over to you, Charity. The recommendations. And I'm sure the whole country was looking forward to this. Those who follow the task force, just take us through the recommendations.
No problem. So I'm happy to go through this. I'm cognizant that the target audience for this conversation is, the youth, persons with experience, mental health conditions, caregivers, but I'm sure there are also other Kenyans here. So what I want to encourage you is, sometimes there are some big words that you may see, but usually it's things that you know. So if you hear me say any big word, please put it on the Q&A, and then
Yes.
ask me just in case. Yes.
As much as possible to make this not a conversation between Eddie and the guest. So what we try and encourage, not yet, or we have chat. If you have a question to something she might have said, you might have feedback or comment. Please use the chat area as much as possible. I will be looking there from time to time and checking out the questions. And then as we go on, Charity, I might be stopping you just to engage you on what I might be asked some about something somebody heard about you say in your conversation. But so we've opened the chat area. Please use it as Charity takes us through the recommendations, which is part and actually the pillar of this conversation. A look at the recommendations from the task force report for mental health in Kenya.
Okay. So thank you again. We have an excellent report, in my view, that has covered a lot of issues. And what you will find, and by the way, there are many reports we are not able to understand. And one thing that we consistently said as a task force was, let us simplify the language so that Kenyans are able to understand. So don't be intimidated, to read. The first recommendation that we came up with, and these are, out of every chapter, there's recommendations for that chapter, but these are the overall key recommendations. And the first one is setting up of a mental wellness and happiness commission to monitor the state of mental health and happiness. Why is this important? Number one is, when the public participation was happening, it was very clear that, people don't understand what mental health is, what
We've lost you. Can you hear us?
Niko sawa. Mnanisikia sasa?
Yes, you can hear you now. Go on.
Okay. So one, because of the lack of understanding in the different 10 regions, because of the acknowledgement that mental health is not just a health issue, it is an issue that should be addressed through our Ministry of Education, through our employment, and that is labor, and also the Ministry of Labor and Social Protection. We need human rights people, we need people with lived experience, and so on. We realize that for us to do a report without recommending that we have a body that is able to monitor for a long time, but also able to bring in the different agencies to influence the changes that need to be done that we have recommended, we realized we need a national body on the long term, so that the recommendations that have been made and the issues that were raised by Kenyans are not just put in the report, but then there is a national body that can actualize the recommendations that are there and bring the different agencies and people and stakeholders together. So that is the first recommendation and why it is important. And so in the report, there's actually a breakdown of who should be in that report and what they should do, but generally it is to monitor the state of mental health and happiness and respond as well. So the second recommendation is declaring mental illness as a national emergency of epidemic proportions. So I just want to correct, you know, a lot of Kenyans who are calling it a national disaster. Within the health space, there are, you know, a national disaster is taken differently from a national emergency. And so what mental health falls in right now is a national emergency of epidemic proportions. And why is this declaring important? If you remember, years back when we had our late President Moi, he declared HIV as a national emergency of epidemic proportions. And what happened as a result is then it attracted attention. It attracted the attention of the country. It attracted the attention of the Ministry of Health. It attracted the attention of the donor community, the international community, and so on. And so it brought in not only attention, but then funding in order to have the human resource that we need, the infrastructure that we need, the testing facility issue of declaring mental illness as a national, the wheels start turning. Because yes, we have seen where the issues are, but for it to be addressed urgently, then this is the right you know, term within the health world for it to be given the priority it deserves. Because let's not forget that mental health will not be the blue-eyed boy forever. You know, the light is on mental health for now, and it will move on. And so we need it to be addressed as an emergency. So the third general recommendation our overall recommendation that we made was to carry out a national mental health survey. What does it mean? In the participation and in all the talks or discussions that we had, we realized that, okay, research within this country, mental health research in comparison to many African countries, we actually do have some research. But at the same time, the problem is that this research is mostly in small populations in specific areas, targeting a specific outcome, and you know, where the survey is done in the and so without mental health that has samples representatives of people from different areas, then we are not able to say for sure what is the exact burden of illness, of depression, or how, in terms of number of people who have each illness, for example, it is not possible at the moment to do it on a national scale. So anything that has been done is an estimate from a small scale. So, and you know, data is what drives practice. And so for us to get this data, we need a national mental health survey because we have people with different economic status, different tribes, different beliefs, different conditions in different areas, and that will help us get there. So the fourth recommendation is to fast track Mathare teaching and refer as a government agency for specialized referral research. This sounds like complicated. Basically means is that for
sorry
okay, Mathare Hospital, which is my hospital.
Sorry to interrupt you, Charity.
Yes, yes.
So as you continue to go through them, I'm also posting them on the chat area. For those who would like to also follow the chat area, I'm posting each recommendation as you read it so that they can refer quite clear on what you say. I was just letting them know it's there on the chat.
That's an excellent idea, thank you. So I was talking of fast tracking Mathare Hospital as a semi-autonomous hospital, and I was saying that Mathare is my hospital, and one of the reasons why mental health is so behind is because our institutions are not given the capability, the permission to thrive on their own. And so and of course, you know, many of the people we had coming for the participation and even task force members have been in these same facilities. And it has been recommended even before, but it has not been done, and it needs to be fast tracked. So the process has started, but it's very slow. and it needs to be fast-tracked. So what are we saying? We are saying that when Mathare is made a semi-autonomous government agency, it will be able to have its own board, its own budget, and things like that, so that they can specialize. Because sometimes when you're, all clumped under one department, growth is not that fast tracking for us is very important, but also so that they can provide specialized facilities, specialized services for referral, because we have people who come from the whole country, for teaching as a teaching institution, and research, and not only for psychiatry. The world is moving towards neuropsychiatry. Why? There's a lot of overlap between neurological conditions like epilepsy, or even comorbidities being the illnesses that come together in one person. Like you don't have one condition, so you find I needed to go through an AI, which is a scan of the brain, to show if I had a brain injury, because the symptoms I was having could be brain injury. I also did a thyroid test, because the symptoms of bipolar are similar to symptoms of hypothyroidism. And so you find a lot of patients assume that it's a psychiatrist that you need to go to. But if mine was a brain injury, overlaps between, we are only asking for the or recommending for Mathare to be semi-autonomous, but will also be a specialized facility for neuropsychiatry, so that it covers more conditions in one. Number 5, we have the implementation or the recommendation to implement a multi-sectoral approach to mental health challenges, similar to the one adopted in 1999 against HIV/AIDS. So I think I'd mentioned this a bit when I was talking about the commission
Yes.
that we are recommending. And so what we are saying is this cannot be sorted by health alone. If I have gone to Mathare Hospital, and because of my symptoms not being seen in time, and I'm living alone, then probably I've gotten to the place where I've been auctioned, my house is locked, and so on. When I get treatment at Mathare and I leave, and I still have the same economic problems that triggered my being there, then that means that if I do not have social and economic support to be able to start a small business, or to be able to afford treatment, then that means it's very likely for me, and it happens every day, that I go back to the hospital to be treated again as a health problem. And so it is necessary to have a multi-sectoral approach, so that our religious leaders are able to come together, our traditional leaders, and so on. So that is what we are recommending there. And the other one is very huge, because anything that we need requires money. So basically we are saying that we need adequate financing for mental health in line with international best practices. So what does this mean? It means that, like now Kenya is one of the countries in the 28% of WHO countries that does not have a separate budget for mental health. And that is one of the reasons why we are so behind. And in case you did not know, for mental health has for the longest time had 0.01% of the budget that has been there. And because, like I said, we have specialists in health financing, they are able to say that, number one, it has been calculated that currently we have, when the current is calculated, it shows that we have 25 shillings, 25 shillings that is currently being put aside for our whole population per citizen, okay? And where we need to be is at 225. Let me repeat it. So how health financing? Yes. Don't worry. So how health financing works is, I know. Believe me, I was you yesterday. Yeah. So how health financing works is is, you know, a country has many things in the budget. So you find, like for Kenya, for example, the budget that goes towards health is only 5%. Okay, that's general health.
Yeah.
Now, mental health falls under non-communicable diseases. So we are together with our fellow patients in cancer, kidney, hypertension, and so on. So all of us with non-communicable diseases get 3% of that 5%. Is that clear, Eddie? Up to there?
Up to there, so far, so good.
Okay, all right.
Understanding.
So, okay, so we have 5% from the general health budget, but we have 3% going to non-communicable diseases. Yes, only 3%. And then now out of that 3%,
we still have to fight with the others to get
COVID.
the portion for
and COVID.
Wow. Wow.
Yes, for everything, really. And then now out of that 3%, ours for mental health is 0.01%. Yet, there was an Abuja declaration where, you know, countries were coming together to look at why are we so behind in health. And so a general recommendation made at that Abuja forum, which we call the Abuja Declaration, was that countries should have at least 15%, all countries should try to have at least 15% in dealing with these issues. Many people call the Abuja Declaration is a very general declaration, but general health declaration. But what we are talking about now for mental health is that the ideal, because we are so low already, we have so much to catch up on. And so when it's calculated per person on what health-wise is put aside per person, it's at 25 shilling per person in our whole country. So we are at 25, and where we should be is 250 per person. You understand? Because everyone is at risk of mental illness. Everyone.
Oh, yeah.
According to WHO, 1 out of 4. Yes, 1 out of 4 has a mental health condition. And so our government should ideally be putting aside 250 shillings. It's called, there's a word called per capita, per annum, per person. But right now it is at 25 shillings. So I needed to explain that a bit better because financing is complicated.
How long has it been at 25 for?
Even for me. Sorry?
Yeah. How long has it been at 25 shillings?
Honestly, I am not sure. It's difficult to say, because even now we are having more than has been there in the past. So that I would need to confirm.
Okay, no worries.
But I hope that is clear, please.
Very clear, very clear.
All right. So the next one.
If any of the pointers are not clear, please use the chat area so that we cannot move on without clarifying 1 or 2 things, because Charity is willing and able to just break things down further in case you're not understanding what all these many big words. And Charity, I'm already seeing a comment here from Julian saying, while creating awareness, use simple yet effective strategic behavioral communication strategies that can help demystify stigma around mental health. Of course, Julian, that's a very important point, which is part and parcel of what Charity acknowledged at the beginning, that this sometimes can sound so heavy. But that's why we're having this conversation, and Charity is at a very good position able to break this thing down and make it simpler for us. Sindio, Charity?
Yes. We are leaving one behind.
We are at recommendation 7 now.
Okay. So I just wanted to mention health financing is difficult for. I've taken a bit more time to explain on that. But what happens is when we don't understand, we are not able to push for it. You know, government has a certain language. And so, and also rights have a certain language. And so what we need to do is understand at our small level. And then when we are pushing for it, we throw those words, you know. And so there is a balance of, and for me, if everyone here lives understanding, I will be happy. So number 7. Good. Our recommendation is to regulate and license all institutions offering healthcare, including rehabilitation centers, through the Kenya Medical Practitioners and Dentists Council. Now, many people do not. Rehab centers currently fall under the Ministry of Interior. Yeah, so our rehab centers do not have health regulation, and that is very dangerous because our rehabs target people with substance use disorders, what most of us know as addiction. But that department, while this is a health issue, while this is a mental health issue, because substance use disorders or addiction to substances, that it is one of the 7 prioritized conditions by WP. So disorders and addiction should be at this level. But this person who's going to a rehab is not under health. So what we are saying is that we need licensing to be done under the Kenya Medical Practitioners and Dentists Council, and also monitoring, so that we don't have quacks. Some of us, that probably the ones that we have gone to are led by doctors and so on. But you see, it's very dangerous when the monitoring, when the policy and so on is not done similar to health centers. So that is what that recommendation means, that all this should be done through KPMDC, so that the regulation is done better, and so that even financing is able to go to substance use disorders. And it's very unfortunate that many of our insurance companies actually refuse to cover substance use disorders. Yet, once it gets to the level of disorder, it is an illness like any other, and we need to appreciate that. Number 8, we are recommending the amending and or repealing, I'll explain these words, amend or repeal specified legal provisions that offend the Constitution and acts of Parliament. So what does this mean? We have very many laws. We don't have one law for mental health. We have the Mental Health Act, we have the Psychologist Act, we have the NACADA Act, we have the betting and lotteries, which still affect mental health conditions because of the issues of gambling. We have the Insurance Act, we have the Constitution, we have the Elections Act, the Marriage Act, the Persons with Disabilities, and so on. So there are very many. And what we are saying is there are times that these different laws actually clash with each other. And it's only when you're trying to push something within court or you're trying to provide a service that you realize that they actually act, because no one is there to tell you, And so we are saying, for example, our Constitution refers to people with mental health issues either as of unsound mind or as imbeciles and idiots. That's the language that is in our Constitution, which is very unfortunate. And so we are saying that should be amended. Our language should dignify us. Yeah, and so that is one of the issues that we have raised. But then we've mentioned many other legal issues, so that even if it's the issue of substance use, we are able to at least have laws that help us to deal with it as a mental health issue. One of the reasons why there's that relation of substance use and crime. So sometimes we have petty crimes done, when someone is high on heroin and things like that. And so you find one of the things we are saying is we need special courts and special mental health systems, especially, for example, at Nairobi Remand, because that's where everyone will pass through before they go to their different institutions. But you find many people who are there should not be there in the first place. They should have gone to a healthcare facility. And so that means even before they get there, if we could have people within the police. Sorry?
No, go ahead. I was just acknowledging the first stop somebody is taken to remand.
Yes. So you see, exactly. So our whole criminal justice and mental health, so that they stop so they stop criminalizing mental health conditions. And so these are laws that are coming together to say, no, someone should not be divorcing me because I have a mental health condition, because they don't divorce someone who has cancer due to their condition. It is saying that we have a Psychologist Act, but because it has not been given a body constituted within, that's constituted or that is running it, to be able at least to act. That means, you know, we in our support groups have people who've gone to counselors who have preached for them. A counselor is removing demons from someone, but how are we to know a counselor who has the capacity to deal with a mental health condition? And mostly counselors don't, at psychology level is when, you know, most of them have studied mental health conditions. And so what we are saying is this, the act, for example, by having a board in it, would then be able to regulate, so that at least we can go somewhere and know, or this person, you know, is at this level and this is what they can handle. And so that it's even easier for the government to then deploy counselors, psychologists, knowing now, as you know, we have guidance and counseling teachers who, you know, are given the role of counseling, or a psychologist goes both as a psychologist and a teacher, and it becomes very hard to. So there are very many laws. So we are talking of the cleaning of the language, amending what needs to be amended to say that I should have the right to vote like every other Kenyan. I should have the right to follow or pursue a political seat. Yet there are laws that say that you do not have the right to that. Yeah, a member of parliament or a member of county assembly or any public office, which is very unfair. So those are the legal, you know, issues we are looking at. And by the way, we actually have webinars that we've done for each chapter by the task force.
Yes, I'll follow them on
if for more information, yes. So we'll actually provide a link so that you can also, you know, like for this part of legislation, which is the, you know, the laws, the legal aspects, the policy and governance, you're able to understand in more detail. And they're available on at MUH Mental Health. Eddie will share for us. And so what we're saying is these many laws, we are asking for either repealing or amending what they say. Now, then so gazetting it makes it official. Experience to have platforms to my experiences better, able to celebrate health workers better. We are able to provide platforms to bring in our communities to list, ask, and so on. And helping mental health materials for you that stigmatization. Now, any buzzwords on social media, you know, buzzwords that are not really attached to something. So we talk about stigma, but we don't realize that yes, it is this stigma that is that affects me as an employee. I am in a certain facility, a certain workplace, and because I have had a relapse, I am fired. That is stigma. Stigma, children with special have to go to a, it is stigma, that special unit. There is no special community for them to live. And are you stigma in churches when someone who you know probably had a relapse at some point, so they have a mental health condition, now they are working well, the church. So when we look at it that way, then it means that for us to be able to impact within the church, to impact within the church, to say, by the pastors, this demon are removing of them are mental health conditions. That means we need to develop literature that is specifically for churches. If it is teachers and we are saying there are children with ADHD in our classes, many of them do not need a special system. They need reasonable actions or like things that we can do for them within the normal system. They can. So we need materials for this teacher to understand. We need materials for the community health workers in Kisumu to be able to see, so that is a very, big thing for us, because if we just look at this as a health issue, we'll never be able to fully deal with it. And so multi-sectoral approach is, yes, it's just mandatory by the way.
And that as a recommendation. Table, we bring in the we bring in, which I believe it's part and parcel of what is going to support the actualizing that particular recommendation. And I know there are quite a number of other, people we also not bring those who practice it on the table. How it's amazing to see some countries. I know, Charity, I don't want to sound as if I'm hurrying you up, but we just have a couple of more minutes. And we want to engage the participants. Already some comments are coming through, and I know some of them have questions. And
let me rush by the time.
I don't know if you know Caroline. Caroline, she's the lady who submitted a bill to Parliament in regards to councillors, the lead councillors in public facilities. She's here with us. And I'm glad that she's here also, so that, our voice as her is very important, together with her husband, James. But once we're done, I think we have 5 more recommendations to go. We will then engage with the questions from
let me try that.
Okay.
Yes, I know I get carried away when I talk.
No, I think
so thank you for.
We don't get these opportunities every day, and I think a lot of people here can agree with me. We don't get this opportunity every day when things are explained to us to make us understand the jargon and the big words and the language that is used frequently when we're talking about mental. So we are honored. As much as we are working with short time, we know we can maximize on it, but we are honored. Don't feel rushed. Don't feel I put a gun on your head. We are benefiting from it.
Okay, I'm very glad to hear that. And about religious leaders, I'm very passionate about. I have talked to several religious leaders. I've talked in churches and so on. And one thing we acknowledge is that as an African country, and especially in the Kenyan context, have people been going for healing of mental health conditions for years within more urban areas. Then you have these people, instead of going to a traditional healer, going to a church for healing. And there's a doctor called Dr. Mutiso with Gilead Health, who is a very renowned psychiatrist, and he was speaking to churches and telling them, do you know that the average time it takes for these people to come to us as psychiatrists is 10 years? And they either, during those 10 years, they are either with you trying to get healing, give them, special levels without knowing that this is a symptom, and traditional healers as well. And we have programs. We have a program by African Mental Health Foundation in Makueni, where they've actually trained traditional healers in mental health, and they are referring people to the hospital. So it is very important. And you'll also see in the document is WHO Mental Health Gap for low and middle income countries. They were looking at different countries, and they said for Kenya and other low and middle income countries, they're really psychiatrists per se. Of course, we need them, but the bigger gap is being able to refer people for and people to refer the people who are in contact with many people in the community. Are those chiefs they are our APs, they are our teachers, they are our religious leaders and traditional healers. They've recommended a basic training for 3 days, so people are able to know what to look for. So I agree with you. I think I was on point.
We were going to
I was
11
where?
now.
11.
11.
Okay, thank you. So,
11.
yes, many of you know Senator Kasanga, and so the task force had a meeting with her and looked at the different things the task force and the Senate wants to achieve through that bill. And so this is to say that the task force supports this bill, but they discussed. Sorry for saying we had different teams going to different meetings. So the task force discussed certain amendments to be made. Yes, certain amendments to be made with the bill. And my favorite, involve carers and users of mental health services at all levels of policy, legal, policy development. This is very close to my heart because this used to being of health services, mental health. When those mental health services, they succeed for us. When they fail for us. Yet no one asks for our opinion. So you are saying for a hospital, in fact, for me, I believe, honestly, if there was a patient we had chosen to be in the KEMSA board, we wouldn't be waiting to do how many months for it to now be on the news. Because as a patient, you have everything to lose when things don't work right within health systems. And so we are saying we need to be involved in policy at national level, which is what we have started. And I pray that this will be the only time we will have had to fight for it. It is something that before a doctor is called, a patient should be called and told we have this committee and we need you to come, so that we are able to participate in the systems that are there for us. So I pray that this is the only time we will have fought for it. And when we say policy, it's not just at national level, it's at county level, it is at the clinic near you, because in fact the next recommendation is to decentralize mental health services to the primary health care level. What does primary health care mean? Primary health care is the first place you go that is close to you. So that is a dispensary, that is clinic, that is a health center. Yes, yes, Eddie. So we are saying you do not need to go to a specialized facility for mental health. Let me tell you, for me, I was treated for, I don't know what part of my body has not been treated, by the way. But later is when I realized, because there are things called psychosomatic symptoms. We just mean sometimes you can have a headache, but it is not a physical problem. It is a psychological problem that is causing it. Sometimes you can have backache. Like even when you're dealing with a loss of a loved one, you suddenly have pain within your body in places you did not even know, But sometimes these are psychological issues. And so we are saying, and by the way, mental health, and I think that's in the next recommendation, mental health is actually not an examinable subject for many nurses or clinical officers and so on. So even when you go to a mental health facility, many of them do not know the symptoms of mental health conditions so that they are able to take it for care. And so we are saying mental health services should be available at the primary healthcare level. And that means that the training of those clinical officers and nurses, who are the ones who see majority of Kenyans, not doctors, but even for doctors, they also said they need better understanding of mental health. 14 is train and recruit mental health. Exactly. So to recruit them so that they can bridge the gap. And this gap, it should be bridged clinically. And so we invest in human resources, training, recruiting, and deploying. So that just means we train them, we teach them, and then we send them. Because even in Makueni, there should be clinics that, if you go to a clinic, you should find someone who understands. So lastly, the mandate, by the official mandate of the task force ended on 28th of February. Because you remember we had only 80 days. And
80 days, that's right.
What happened is, yes, and at that time we were supposed to then hand over the report to the CS, who was who was the Mheshimiwa Kariuki at the time, but she was handing over to the new CS, is it Mheshimiwa Kagwe, that's the CS, the able to, give the report during that handover, and COVID happened. We had to wait to have an opportunity to present the report. And we said our mandate did not include this pandemic, but we would be irresponsible if we did not use this opportunity to then say that we need mental health to be handled better in the next pandemic, because the truth is many more people issues during COVID because of social stress, of not being as we are used to, not even being able to bury the way we are used to, not able to greet the way we are used to. There is socioeconomic problems, many people are jobless and so on. So we have a mental health crisis as a result of this pandemic. So number 15 is to say that we came up with recommendations, that we feel would help to deal with a pandemic crisis in the future. And many of these recommendations are similar, very similar to the general recommendations of the task force. Because when we do these things, then that means, God forbid, if a pandemic happens again, we will be in a better position to deal with the mental health issues that we will have. So I'm done. Thank you.
Okay, thank you so much, Charity. Of course, we would benefit a lot to have more time to go into detail. But I appreciate you breaking it all down in a way that we can now chew it up and understand it a bit better. So I'm just going to read a couple of they're really comments. I'm not seeing much of. I think people are really digesting what you're putting forward, and mentally unsilenced is here also, and he says Charity is quite informed. This is very informative. Kudos, Charity. I love your dedication and passion when it comes to mental health issues. This field needs more people of your caliber. Proud of you, sister. Well done. Thank you so much, mentally unsilenced. And then we also have with Nancy Gashoka, who is a caregiver. And she says, I agree that there needs to be a body that follows up and raises awareness in every village about the magnitude, what, why, how. And then that now leads me to a very important question and a comment. You mentioned about Makueni, which is apparently in a report, it was indicated that it is the happiest in an index. It was listed as the happiest county in the country at 64.4%. So there's something they're doing right that seems to be attributing to those conditions. So that means mental health there might be issues might be at a low level. But then again, the question about how do we then break down this report and the recommendations to that common Mwananchi in the village, in the community, so that they can be able to understand it. Because us here, we can access internet, we can access Zoom, I can see you, you can see me, you can hear me, I can hear you, but that who's there under that tree in the village, or that Shosho who's wondering how her son is doing in Nairobi, maybe her son is, going through some really deep, challenging mental issues, and she does not understand because she would want to help. But this report would also help her understand where we are heading as a country in terms of handling mental health.
Okay, that's an excellent question. Like I said, in terms of the report, the mandate was 80 days to deliver. But even as task force members, we felt we can't leave it at that. We can't leave it at a report that goes to a table and to hope that the commission is put up to continue. So even the webinars and the trials many of you with are an effort towards that. However, this is the report stage. The next is the implementation stage. By the way, remember, we have a very good mental health policy, and by the way, it's part of the recommendations. I don't know whether I skipped it but we have an excellent health policy. So what happened is, in my understanding, it did not have an implementation plan thereafter. So we have come up with an implementation of what should be done with the counties, what should be done at the village level, what should be done within the hospitals, and so on. And the Ministry will be, they've actually told us in advance, we will need your support as Kenyans. We will need your support as users of mental health service. We will need your support to get to your religious leaders. So that is coming up, and I will continue, to provide that information. So it's something that we are very about. So that, and that's why we're even talking about, literacy, that is, because when we say now we are looking at the sector village, then that means definitely the literacy for VOIP will not be the same as Kitui. It will be customized for that. But also to say the people who already have networks within those places, and we are also encouraging caregivers, please be in support groups so that you're able to work together, to push for initiative together, because we are very key, and that is also in one of the recommendations in the section of stigma and discrimination, that we are the champions. We've gone through, hell and high water, but now we are better for it, and it is easier for people to leave stigma when they hear you, talking, and they see, kumbe uko sawa, So we have a very important role to play when the implementation comes. But even before then, where you are, me always say, start where you are with what you have. For me, one thing I have had even during 5 years of joblessness is my phone. I have postpaid, I have 900 minutes per month. So what is it you have? Are you a teacher? Do you have children? Start with those children. Are you I don't know, are you good at policy? Let's push these issues of policy together. Are you a good moderator like Eddie? Give us opportunities, and let's go even to, let's do a webinar for Kisumu, and Danish Korogas that Luo nicely. So we need to start where we are with what we have. Let's not wait for perfect. You use what you have, and you use it well. You'll be surprised. So use that.
Amazing. We start from where we are. We always tend to believe we need bigger things to get things done. We need the latest laptop to have such a connection, but even just your phone just gives you access. Things are being made simpler right now. And of course, as much as it is getting simpler in terms of technology and innovation, COVID-19 has not spared us in terms of how it is affecting our mental wellness. And I know there's a bit that came up in the task force report. Maybe if you could just touch lastly, where does the COVID-19 conversation this task force? It's just formed, then COVID happened. So in a way, I think it was sort of a prompt to be able to also look at the underlying issues that you never really looked at, that have now been compounded by COVID coming out.
Yes, I get you. Actually, I think I had started that story and then it deviated somewhere, because like I was saying, we saw very, I know.
It's important.
So we saw that
we talk about it.
We need to do something about it. Yes. So so what we decided to do, there is also the official issues. So what we did was a postscript. That is to say that after doing the report, we have also added a section that is a postscript to address an issue of COVID that has happened when we had to wait because of COVID, and during that time, we decided to talk about it. So we talked about how it has impacted people and it's just 2 pages, how this has impacted people at a personal level, the uncertainty, the fear, the economic challenges, the relationships. We know we've had a lot of gender-based violence in families because families are spending more time than they have ever spent, and you're learning things about someone you've lived with for years that you never learned because you are busy in your offices most of the time. And so there's looking at individual, there's looking at society. We are confused, like I said, we are not able to greet, bury, congregate, and so on, and that is stress. And then there's also the health workers. Our health workers, especially COVID workers, are working in psychological stress. I mean, they're human beings. They may be professionals, but they're human beings first. And it's not easy for them. Even simply, we are stressed by just seeing figures on the TV. For them, these are not figures, they are people. It is families, it is fathers, it is mothers, it is children crying, and so on. And so that has a psychological burden. And so we have a lot of COVID healthcare workers working with COVID and other illnesses as well, who are finding themselves with mental health conditions, and especially PTSD because of the trauma, but also other illnesses due to stress, because we know that stress is a big factor and trigger of mental health conditions. We've talked about how it has affected us as a globe. And what we have said is being able to provide different facilities, and there are documents that have been done by the Ministry of Health, Mental Health Department in saying we need teleconsultation services and so on. But the recommendations for COVID were specifically in the report the same things we've talked about. You know, we need KEMSA to style up and provide good second generation medicines that are not banned in other countries. We need psychological facilities. Eddie, you are with us as a team, and with Wawangoi and Nancy and others, when we pushed and said, you're telling us not to go for follow-up clinics. You've sent us messages. Who are we supposed to talk to? And that pushed the announcement for a national hotline, you know, so that at least you're being told not to go, but you can call and talk to someone. Yes, so those are some of the issues. Many of them are very similar to what we are talking about. Because if we do not have, you know, right now, it's very possible we be the first to be let go because you have a mental health condition. That is stigma. So the same things that we have said can apply to the and others. So children are stressed as well. Eddie, you wrote very mental children. So saying that it takes a multi-sectoral and multi-activity approach to deal with mental health in this country is the same way we need for COVID. The psychological that people stress, where are people being, if I need medicine and I'm not able to afford clothing and shelter, see, I'll be non-compliant. Yes, yes. So it's not one answer. It's all these things customized.
Definitely, that just sums it up all. It needs a community to actually get to do a lot of these things. Even the task force report itself, it needs us as a community to see being realized and coming to impact our lives. So I'd like to say once again, thank you so much to Charity for that. I know, again, I always say this at the end of the conversation. I wish we had more time, but you've started the conversation. You've joined us in this conversation where we were before we came onto this show. So we have new knowledge, we have new information, we have new understanding, and it's just a matter of applying it and even just having a better perspective and a mindset to all these recommendations, which are very, very important. We just hope it doesn't gather dust on the usual shelves. You know those shelves. A lot of reports are just wondering when will they be, or nobody's seeing them. But a comment here from Patrick. Patrick, forgive me if I pronounce this wrong. Patrick Borouet. I think it's Borouet, if I'm not wrong. Says, let's start where we are. I agree with you, Charity. Our individual effort will bring collective power to transform the landscape. And then Nancy Gashoka, I think she's posing she's posed a message here, which I think I'm going to advise you, Nancy, so that you can know what she raised. Currently, I have a friend whose son has become very violent after selling all his belongings one at a time and lives at Njiru in Island. Now the police and chief in Kiumbweni ward of Gatanga are all mesmerized with nothing left to do except wait for anything to happen to the mother and the sister who has major disability. What do we do from this forum to help such a rural single mother? I took personal initiative to educate her, which we commend you for this, Nancy. And you took personal initiative to educate her on mental illness out of substance abuse. She has lived in denial, hoping that spiritual interventions is enough. But after she was started to near this, she has started to agree that may be. It's unfortunate that sometimes it has to come to this point where somebody is physically, impacted to get it through. But unfortunately, that's unfortunate. And yes, there is an issue. So I'd rather, because we don't have much time, I know you Charity, unaweza changia kwa hii very, very positively. I'll ask Nancy to reach out to you kindly so that you can maybe hold her hand with the journey with the people she's trying to help. But for right now, I'd just like to say thank you once again to everybody who've joined us. Charity, always a pleasure to listen to you talk. Very passionate about it.
Eddie,
and I thank all the regulars who are on this show.
Allow me to say something, because when I posted this poster, I had mentioned I'll go through the user and caregiver presentation, but we are not able
to
go
user and caregiver conversation. We don't have much time, but
yeah, so we did manage to do it.
This conversation. Yeah.
Yes. So we did this with persons across cerebral palsy, autism, ADHD, and so on. I cannot go through them because of time, but it's on page 87 to 89 of the report. So see what it is we came together to talk about: the stigma that we go through, our challenges with access to health services, our legal reforms problems, social protection, and that we are not being supported within disability the way we should, and education and employment. So those are the 5 areas we've tackled. Please look at them. Nancy, let us talk. By the even as support groups, we have patients who are not being able to afford rent and food, and we are having to fundraise together between ourselves to be able to do it. And I'm happy to do that with you. But I also want to say, anyone with a mental health diagnosis in this meeting, please take care of yourself. What we have been through, let it not destroy us, let it build us, let it become the scar that we put a flower around and let people know that this is doable, this is possible, but we also need each other. Please, my email is charitymoturi@gmail.com. Eddie can put it up there. Please reach out so that we come together as users of mental health services and caregivers across many. My fellow caregivers, thank you for being a frontline worker in your home every day with no break. God bless you, and may you get the strength that you need. Our youth, I know we encouraged youth to come. Please serve. Please be a solution provider. We need solution providers in mental health, and you have more energy than we have. You have better ways of dealing with social media and so on. So don't stay at home. Even if it's 1 or 2 days a week, look for somewhere, volunteer towards improving the mental health. And for all of us, let us not say we are hoping it does not land on a shelf. If it lands on a shelf and stays there, we are responsible. Let everyone use the opportunity that they have to say, we have a mental health task force for what is being done. Let's not allow it to rest. Thank you.
Right. Thank you so much, Chari. Someone could copy. Oh yeah, there it is. Thank you. Hey, out on the technology of our convey for joining us once again. Smith, as always. Well, it's good to see you on this conversation. It's really have you here. Yet, sorry if I pronounce your names the wrong way. Please forgive me. Nyet, I'm not quite sure how to pronounce that. Nancy Gashoka, thank you also for the engagement. Miss RM, asante sana. Mentally nguvu wata zaidi bana with what you're doing. Fantastic. Thank you for being with us. Julia Nanyango, thank you so much for coming back. Damaris, Kanana, Asante, Crystal Crescent, always good to see you with your very cool profile photo. We have conversations improve your, well, it doesn't show me the full name, but yes, conversations improve your, okay, it doesn't give me the full name. Thank you so much. Agnes Makumi, asante sana for being with us. Charity, again, asante. James and Caroline, najua hatukupatia nafasi, lakini I know you're here and your presence is very important. Caroline is a lady who put forward a bill and in Parliament, and that is to do with these conversations. If it does not hit the Parliament or anywhere or other higher office, it will be very sad if it doesn't do that. But I know we're all passionate about this and we're going to, see this coming through. So Ivy, our chief whip, she's the lady who's at the background of this campaign, and she's the one who's been running all that's been happening today. She'd like us to do a family photo, or if you like, a portrait of everybody. So I'll ask you to have your videos on so we can have this. We need to remember these conversations and to acknowledge each and everybody who's here. Naona Bwana Nyete ameweka kamera. Asante sana. Thank you so much for for letting us see you. Wange, always good to see you. Wange, mentally silent. Enda kinyozi ndugu ama ni COVID? Yeah? All right, fantastic. So Ivy, you're happy?
Nagoja watu bado, but I've gotten a few.
And Agnes ameakisha kamera. Asante sana Agnes. And now there's a friend of ours here who has a long name. I'd like to conversations improve it actually ends there. I can't see the full name. You've muted your mic.
Conversations improve your mental health.
Fantastic. Thank you so much. And tunashukuru sana. And then Miss RM, that is Missy Crafts. Again, Damaris Kanana Smith. Nawaona vizuri isipokuwa Sharon amejificha. Miss RM hataki tumuone. Smith sijui ako chini ya mti gani leo. Smith always makes us feel bad because he's in a very sunny, beautiful environment. Leo hataki kutuonesha, but it's okay. So Ivy, you're happy?
Yes, Niko
All
poa.
right, fantastic. So once again, take care of yourselves. Tafadhali jipende. Take care of yourself. You heard it from Charity herself. Please, let's work as a community to make this possible. This report is very important. And Caroline, again, I really applaud you for the big steps you've taken to push the agenda to have counselors in public facilities. It's very important. Even in our public schools, we should have counselors. So looking forward to good things happening in this space. As much as COVID inatunyorosha, tutaiambia tunawezana. All the best, guys, and have a fantastic weekend and good afternoon. Kwaherini. Bye.
Yes, bye.
The ones who have missed it, it's on our Facebook, and we're also going to upload it on YouTube. Thank you. Hi, Charity.
Hi.
Hi, I asked for your number.
Oh, okay.
Yes, I don't know if you saw my message. Can I ask Eddie if that's okay with you? Hello?
Sorry, I seem to have lost you. Can you hear me?
Yes, I can
hear you.
I've unmuted.
I think you are muted.
Yes.
Okay.
Can I ask? Yes. I wanted to ask Eddie for your number. I asked you for your number earlier on.
Okay.
Yes, because we are the ones who have. Oh my God, you have really inspired me, and I actually did some little research on you, kidogo, because
thank you.
because I'm behind myself. The company, I'm Ivy. Then Project Tours is also my partner. Is called Brand. He's our graphic designer. And we are the ones, we currently are the consultants with Basic Needs, Basic Rights. We're the ones who have been doing the campaign, but it's actually ending. Yes. Okay. Yeah. Okay. So I was just fascinated with, I wanted to find out with what is, because I know you also in your field, especially right now, what you mentioned about social media is really impactful in terms of pushing mental health awareness, especially right now with people are at home. So this is the perfect time to push the agenda. So I was wondering, because with what we have seen with the last 10 weeks, how impactful we call it the Be Mindful campaign has been with the youth. People did not know about these things, and I'm even shocked with what you've even spoken today. So I wanted to find out, currently, I know you work with a lot of organizations, and I wanted to find out if you are able in a position to maybe where you are situated at, and they need of pushing through social media management of sorts in any organization that they would be interested in, would love to have a meeting with them and see how we can help. Yeah.
Okay.
Yes.
Wow. What do I say? I think within the mental health space, we have a few large organizations which you know about.